Hello there, and welcome to this online course on virtual screening for drug discovery. Myself, Syed Hussain Basha, so I am the head of R&D at Innovative Informatica Technologies, a in silico gene to drug discovery service providing company based in Hyderabad, India. So I have about 10 years of experience in the field of in silico, drug discovery with over 30 plus international peer-reviewed publications and real-time experience in handling industry level projects. So coming to the today's lecture topic, like what is virtual screening? So virtual screening, which is also popularly known as in silico screening, is a computational technique to analyze large chemical databases to identify potentially new drug candidates against a given drug target by definition. Okay, so what it means is uh, in the current scenario, there are millions and millions of compounds availability is there in the current market space, whether it is a commercially available compounds or natural compound databases, or someone is designing novel compound library for a target specific, or any other databases. You can simply take like PubChem, Zinc database, ChemSpider, those kind of online available databases which are hosting like millions of compounds readily available for you to purchase and screen in your lab. However, when it's coming to screening of the compounds against your particular drug target of interest, using traditional methods like in silico, apart from in silico screening, like in vitro or in vivo screening, it is a huge task and it is going to take enormous time and money consumption during the process of identifying a lead compound from the given compound library. So in such a scenario, the commercial companies and the people who are targeting for a novel drug discovery against a particular drug target or a particular disease, they are relying right now on like virtual screening. So basically the virtual screening is nothing but like we are going to use the computational techniques and algorithms, and we are going to score the compounds based on their binding ability to our drug target of interest towards finalizing few lead compounds for in vitro in vivo kind of analysis, rather than directly jumping into the in vitro in vivo screenings with a direct compound databases, compound libraries. Okay, so how we are going to do that, how we are going to process it? So basically how we are going to data mine the chemical space to identify those few lead like compounds against our particular drug target of interest. So that particular technique is called as virtual screening or in silico screening. So before getting into further details, let us try to understand like why people are relying on this computer-aided drug discovery technology, because it is helping us to identify small molecules for further studies, basically by saving a lot of time and money. And that is the real a pain point when it's come to the novel drug discovery, because each and every a typical drug discovery process will take at least like 10 to 20 years of time. On average I can say like 15 years of time to find a potential drug candidates to come into the market. But right now, because of the need, we cannot like spend decades of time for a novel drug discovery projects, especially like lead identification phase, which is actually consuming the majority of time in a real traditional methods. So here there are a typical workflow I can say, like how a virtual screening is helping to identify lead compounds by skipping maybe like skipping the biochemical assays and in vitro in vivo studies. But this is normally when combined with the in vitro in vivo studies that will give you most promising compounds as leads or hits I can say for your particular drug target of interest, compared to like only relying on the traditional methods. So by taking the typical workflow, what we usually do is like we virtually screen the compounds based on their ADMET profiling, that is absorption, digestion, metabolism, excretion and toxicology profile of the given compound library. Then the identified leads or hits will be further optimized, like optimized in the sense like we are going to design novel compound library out of the lead compound by changing the R groups, etc., all those things. Then the identified lead compounds will be taken into in vitro in vivo studies. So thus screened compounds will be called as the lead compounds. So this is a combination of in silico and in vitro in vivo studies towards identifying the lead compound. However, going to and fro from this in silico method and in vivo will take a lot of time compared to just relying on the in silico method. So in order to cut down that time and cost consumption, so there is a typical workflow plan which involves only the in silico methods to screen the compounds and prioritize the compounds for further studies. So we'll see the typical workflow of in silico screening will right now. Yeah. So this is the typical workflow of virtual screening for lead identification only based on the in silico methods. So we are not going to talk about any traditional methods or in vivo studies. So this particular lecture is mainly focused on virtual screening only. Okay. So by virtual screening, what we require is, first of all, we require a target structure. Target structure is nothing but the drug target of interest, targeting which we wanted to identify the lead compound or a potential drug compound. Okay, so this can be divided into two main methods. So one is first of all, when you have the information regarding the drug target of your interest, that target structure is known, and in a case when your target structure is unknown. So if in case when the structure is known, it again depends whether your compound is already known, which is particularly binding to a drug target of your interest, especially at the binding site of your interest, or unknown. So based on that, we can further divide the structure based screening into two types, actives known. Active in the sense here actives means the compounds which are active against your drug target of interest. Inactives means which are not actively binding to your drug target of your interest. Okay, so based on that we can further divide these two. And again, coming to the unknown drug target structure also, so in that case what we need to do is we need to rely on the homology modeling techniques to model the drug targets beforehand, before going into virtual screening. Once you have the modeled structure, so these unknown structure based screening can be further divided into actives and inactives again. So if you have a combination of actives and inactives, then you are going to rely on the latest methods, so which are nothing but machine learning based techniques, etc. So there are novel algorithms are coming out based, which are purely based on artificial intelligence, data mining, the big data analysis, and various neural network based kind of lead generation kind of stuff. So that is the out of scope for this present lecture. However, I have made another video, so if you are interested, you can check my profile and get into that particular course. Okay, and when in the case of the actives, so then this particular screening can be further divided into pharmacophore based, or shape screening based, or similarity screening based. So these pharmacophore features of the compound of your interest and shape of your compound of your interest will come under the 3D features of the compound. So when you don't have this kind of specificity for your lead identification project, then if you are just relying on the similarity, 2D similarity of your compound, to find out the lead compound, then it comes under 2D actives, similarity search based actives virtual screening. So once you identify these kind of lead compounds, they can be further evaluated based on the techniques such as docking, etc., to rank the compounds and finalizing the lead compounds. So this is one of the typical workflow, how we are actually implementing the virtual screening to identify lead compound. So we will see there are different types of virtual screening are there. So and all those types of different types of virtual screening, and how they are different from each other, and when and where we need to apply those different types of virtual screening at what particular stage. So all those things we are going to discuss in coming lecture. Okay, yeah, thank you.